So we know that bispecific antibody therapies have defined a new standard in a number of different clinical contexts, both in relapse refractory follicular lymphoma as well as large cell lymphoma. For large cell, we have two approved antibodies, glofitamab and epcoritamab. For follicular lymphoma, we have two approved antibodies, epcoritamab and mosunetuzumab. In Europe, we have an additional approval of odronextamab. We know that this class of agents collectively is B-cell lymphodepleting by its nature. It's a CD20 by CD3 mechanism of action in the treatment of B-cell lymphomas. So it should come as no surprise that as they do B lymphodeplete quite deeply, that there should be risks of infectious complications. But the severity and frequency of this still continues to be clarified. And we've updated some findings from the ELM-1 trial and other clinical data sets to show that indeed infectious complications can be quite common. This is true whether you're using these treatments in earlier or later lines of therapy, and it may be true with or without concomitant hypogammaglobulinemia. Certainly, a recognition of the importance of antibiotic prophylaxis is key, and we do routinely offer antimicrobial prophylaxis for patients being treated with 20x3 bispecifics, including prophylaxis against activation of VZV as well as PJP pneumonia. Certainly, a recognition and surveillance of quantitative immunoglobulins and in consideration of initiation of IVIG for patients with hypogammaglobulinemia being treated with these agents is very relevant. But we're also beginning to understand and have some clinical models to predict who may be at heightened risk for these complications. And we showed from data with odronextamab, for instance, that the CAR hematotox model is quite predictive of complications with these treatments, not just in terms of response, overall survival, but specifically with regards to infectious complications during the first 90 days of treatment, suggesting that higher risk patients, as defined by the CAR hematotox scoring system, may benefit from heightened surveillance or heightened prophylactic approaches.